Hey guys, I'm doing epilepsy and concussion because my sister is epileptic and she's always been worried about getting hit in the head. So what I wanted to do was find out why that would be a bad thing. On your sheets, you have some practice questions and a bunch of descriptions of what happens during a seizure so you can identify it in other people. There are a bunch of different ways that you can get epilepsy, but I wanted to draw your attention above my head. 6% of patients with epilepsy have traumatic brain injury as the cause, but most people don't know why they have epilepsy at all. Okay, so one of the ways that people can have an idea that they're going to have a seizure is with a prodrome, which can happen a couple of hours to a couple of days before the seizure happens. It's not part of the seizure, it's just kind of a weird sensation, and people tend to associate it with their seizures. The other way is an aura, which is kind of an early part of the seizure where part of the brain starts seizing, and if you have a partial seizure, you just have the aura. If you have a full seizure, it goes from that part of the brain to the entire brain. My sister gets déjà vu and jamais vu. Jamais vu is when you feel like something is really unfamiliar, but it should be familiar. Number 2, people cannot swallow their tongues. What happens during the seizure is dependent on the location in the brain in which it happens. So my sister gets them in the visual cortex back here, so she starts seeing strange things, like she'll be looking at a car and it'll turn into a phoenix head. She doesn't believe it's a phoenix head, it just looks like a phoenix head. So number 3, a lot of the things that you see here are prevalent in the life of athletes. But the things that you really need to think about when you think about what will trigger a seizure is change in routine and overstimulation, like flashing lights, whistling, high-pitched music, lots of sound. You can see how an athlete can run into these things on game day, and it can cause a problem. We've gone over concussion symptoms a lot, so I'm going to keep this one short. Up above me is a concussed brain. That looks an awful lot like a brain that's having epilepsy. A lot of these common symptoms for the concussion mirror that of common symptoms for epilepsy. So a concussion can also be caused by a seizure. So if you're on the ground shaking, or your head smacks against the floor, or you get hit in the head, a lot of things can give you a concussion. The example I have above me, the head careens forward, the frontal lobe hits the front of the skull, the brain squishes a bit, and then this brain goes back into the skull and it hits the occipital lobe. The occipital lobe is where you have your visual cortex. So when you bruise your brain back there, you start seeing stars. The damage to your frontal lobe can affect your judgment. So that means when you have someone seeing stars, they're probably not the best person to figure out whether or not it's okay for them to go back onto the field. You gotta take a look at them. So number 6, everybody has a seizure threshold. The problem with epileptics is that it should be up here for normal people, but their seizure threshold is lower. When you get a concussion, it lowers your threshold as well. So if you're already epileptic and you lower your seizure threshold even more, you're more likely to have seizures. And that means you're also more likely to develop worse symptoms, like going from petit mal to grand mal. When you have someone who is convulsing, what you want to do is make sure they don't hurt themselves. So you cushion their head, and you loosen any tight clothing, and you make sure that they're on their side. Time it, and if it lasts for more than 5 minutes, call an ambulance. And make sure that they know when they wake up exactly how long their seizure took. Now, if they're having a partial seizure and they're just wandering around or they're kind of unaware, make sure you time it as well. And just make sure that they don't, walk down a flight of stairs or anything. Short term, if you've got somebody seizing on the field, they're done for the day. If it's their first seizure, take them to the doctor. If they got hit in the head and they start seizing, take them to the doctor. If they're epileptic and they got hit in the head, take them to the doctor. If they're just epileptic and they're just having a seizure and it's normal, they're fine, you don't need to take them to the doctor, but they're still done for the day. long term, they can be put on medication if the seizures continue, and also they may need to alter some of their activities. You don't want somebody who gets grand mal seizures to be doing laps underwater. Prevention. Don't hit them in the head. And here are my lovely references.